Good afternoon, everyone. We're going to be starting now in the next couple of minutes, or the next couple of seconds, I should say. I hope you're all well this morning, this afternoon, this evening, wherever you are in the world. We've got a huge audience coming through today. So, a massive welcome from myself. My name is Tom Frayne. I'm the MD or the CEO of Scope Eyecare. And we're absolutely delighted to have you here today for our dry eye patient event. This is the second really big, significant dry eye event that Scope has held. And we're very, very looking forward to what we're going to be going through today. Some amazing guest speakers and also a couple of little surprises for you as well. So I was going to kick things off today by asking everyone if you could get ready to get onto the chat or onto the Q&A and give us some feedback, give us some live engagement as we go. Could you tell us where in the world you are and where you're actually watching this right now? You know, are you at work? Are you at home? Are you outside? We'd like to try and have you have a nice relaxed hour with us, but get onto the chat and tell us where in the world you are. We love seeing where people are watching these things. We're also going to be talking to you a lot about questions and answers, and I'll cover that in a second as well. So, as I've said, my name is Tom Frayne. I'm the MD of Scope. We're really delighted you've been able to come today. And this is a big part of what we do here at Scope. Patient education, it's a huge part of our CSR program, our corporate social responsibility. We had an international seminar, nearly a whole day event last summer. And now this is the second event we're holding. A little smaller and not as long, obviously, today, but that's something that we're looking at for this year. We as a company have been in operation for 13 years, and patient education and commitments to services and products has been something that's absolutely crucial to what we do at Scope. So we're really delighted that you've been able to come today, and hopefully you get something very useful from what you hear from our guest speakers in this kind of very practical session that we've got set up. So the first surprise for you is that today we have a test for everyone that we're going to get you to go through. No, that's only a joke, don't worry. We have one of our own, a wonderful colleague, Harj Bartel, who's going to take us through a mindfulness moment in a second, just a simple exercise that I'll let Harj explain. But I wanted to just mention on the Q&A, okay? So we do have, people might remember who were here last summer, our wonderful professional affairs manager, Mandy Davison, who's an optometrist and dry eye specialist. She is in the background, ready to answer every single question that you might have. So get those questions into the Q&A and we'll be answering them live in the background. And then Edel and Dr. Theriot will also have time to answer questions at the end of their session. But Mandy is there, ready to go to get your answers back. And I remember that working really, really well last summer. So get them into the Q&A if you've got questions, please. We'd only be delighted to answer them for you. All right, so Harj Bartel, works in Scope. And I'm going to invite Harj to come in now and get everyone to run through this test. Harj, are you there?
I'm there. Hi, Tom. Afternoon, morning, everyone.
Good afternoon. Over to you.
Thanks, Tom. Well, hello, everybody. I'm just watching these chats coming up about where you're from. So take a comfortable position wherever you are, all over the world, morning or afternoon. I'm going to give you a little gem to take away, hopefully, that will help you get in the right zone for this delightful session we've got for you. So it's a mindful awareness exercise, and it will take literally, I've been told, only 3 minutes, because I then need to hand back over to Tom. So take a moment now to really come into the present moment wherever you are. Take your awareness to your physical body. Close your eyes. Give the opportunity to rest your eyes, which is really important in the context of what we're covering today. So gently close your eyes and take your awareness to the physical body down to your feet. Feel the weight of your feet on the floor. And find a balanced position of your physical body. Allow the mind to be free of any concerns or any preoccupations. And observe the body, your body, becoming still. Take a moment to be aware of where you are now. Feeling the touch of your feet on the ground. Feeling the weight of your body on the chair. Take the awareness to the sense of touch, perhaps the touch of air on your face, on your hands. And then take the awareness to your closed eyes, to the space just behind the closed eyes, and rest your awareness there. Be aware of the sense of smell, the sense of taste. Be fully here. Now take your awareness to the sense of hearing. Connect with any sounds that you may be hearing. Sounds from within the room that you're sitting, or perhaps some distant sounds. Taking the hearing as far out as you possibly can. Rest with that awareness. And take a few moments here just to be aware and present. And then taking the awareness back to the physical breath. Becoming aware of your breathing. Taking deeper, longer breaths. Just to become more aware. And then gently starting to make small movements on your body, physical body, wiggling the toes, the hands, opening the eyes, and coming back ready for the delights we have for you in the coming hour. Hope you enjoyed that practice, and I'm going to hand back to Tom now.
Thank you very much, Hard. Just tell us quickly, how often do you do that, Hard?
That's quite a short version, so I tend to do that, oh gosh, at least 4 or 5 times a day. You can make it longer, whenever you want, but it's a great little exercise to have up your sleeve.
Brilliant. Thanks a million for doing that. I know you've done it in the company before, and hopefully it gave everyone a chance to focus on what we've got ahead for us now, which is getting to lots of useful intel on dry eye and dry eye management. So I'm absolutely delighted to be able to introduce our 2 ladies who are going to be talking us through that today. And first up is Edel Duffy, who is the head of medical at Scope, who joined in 2021. Her brief was to build a medical department to further support and champion medical science to ultimately bring us better products and education and support of our patients alongside the wider medical team and with what we do in CSR. She has a background in healthcare. Edel started her career on the wards of a large teaching hospital in Dublin as a clinical nutritionist. Since then, she's worked extensively in medical nutrition, dermatology, and eye care. Her passion is to use research, healthcare professional insights, and patient feedback to effectively translate scientific into benefits for patients. So that's Edel, and then I'll quickly say a couple of words about Dr. Theriot, and I know Edel will give us a more in-depth introduction, but we're absolutely delighted to have Dr. Theriot, Dr. Pam Theriot here with us today. She is a rock star in the dry eye world, in the dry eye community, and we'd love to, and our massive honor to welcome her today from Louisiana in the US. She works every day in dry eye. She's done it all around the US. She's even written and published a book on dry eye. She's part of TFOS Jews for dry eye. So a massive, massive name in the world. We had her for our international seminar last summer with hugely practical advice for people. So we hope you enjoy what she has to say. So Edel, over to you for what is going to be an absolutely brilliant chat.
Great, thank you, Tom, and welcome, Dr. T. It's great to have you today. As Tom said, just a little bit more of an introduction to you. You know, you're an optometrist practicing in the US, but you have a lot of international experience and you lecture to doctors and to other patients. And, you know, it's something really important because you've got a global view on this from a research perspective, a practical perspective. But I think more importantly, you're here seeing patients every day. So Dr. Theriot is she's sitting in our clinic. She's expecting patients in behind her. So we don't have a live patient organized, but we will have lots of very good discussion. So as Tom said, there is the Q&A box that you can ask any questions. This is your session. I'm here to facilitate, to have a chat with Dr. Theriot, but really we want to make sure that all your questions are answered. So as I said, please feel free, send as many questions as you can and we will do our best to get to them. So, okay to start, Dr. T?
Yeah,
perfect, great,
Sounds
perfect. Good. So there's a lot of people joined in here already and I can see questions flying in, so it's great. But just to take a little step back, because this is all about working with dry eye. But, you know, how do we know that we've got dry eye? Because, you know, are things like itchiness, redness, you know, irritation of the eye, is that normal, or how do we know we've got dry eye?
Well, you know, there are a lot of symptoms that equal dry eye, and it's kind of strange because you could have a dry, scratchy, kind of itchy feeling eye, and you could have a red, watery, stinging and burning eye, and they both equal dry eye. So there's so many symptoms of dry eye. It's not just one thing that would indicate it. And anytime you feel your eyes, that's not normal, right? We should just be able to open our eyes, see, and not know that they're in our heads all day long. So if you're constantly bothered by your eyes, then something's not quite right.
That's a great way. It's a really quick cue. You should not feel your eyes. It's you know, that means, yeah, it's bothering you then. So so are people getting more dry-eyed nowadays? Or I mean, it seems to be becoming more an awareness thing, but also, you know, I think more people are speaking about it. So is it increasing? And I suppose if it is, why is it increasing?
Well, I think we all know that with the pandemic, we've spent so much more time right here on our computers, our digital devices. These webinars have become much more common, and we're working from home, and we're spending much more time, instead of you and I sitting in a cafe enjoying a coffee together, we're staring at a video screen. And the problem with these screens or digital devices in general is that we tend not to blink as regularly as we would if I were looking at your face, looking you in the eye. I would be blinking more regularly and thus coating the front surface of my eye with the nutrients that our tears bring to the front surface of our eye.
Okay. So you mentioned there about digital use. So I think, you know, I just want to reassure people, we're not sharing any slides today. So if you don't want to look at myself and Dr. T, you can look out the window, or I know some of you are in the kitchen, you maybe even be preparing lunch, as some of you are on lunch, and actually some people are on holiday. So I hope you are enjoying your holidays. So yeah, screen use is a big thing. And I think we all can identify with that because there's a screen close to us, whether it's on our phone or on our computer, you know, it's there with us all the time. But you know, are there other factors as well that actually influence or affect the eyes and the dryness of the eyes?
Oh, well, of course, Edel. Dry eye is considered a multifactorial disease. So our health, our sleep, our diet, the products that we put in and around our eyes, things that we put on our skin, makeup, contact lenses, the environment that we live in. So we're all just coming out of winter. Maybe we've had our heaters on, so the air is drier around us. So the time of the year, the season, the pollen count as we head into spring, all of these things are going to affect our eyes. And that's why we consider dry eye to be so multifactorial. We can't put a finger on just one thing that's causing it. And that's why I also feel like you can't just use one thing to treat dry eye. It's a whole process to build a dry eye treatment plan.
Okay. I think that's very interesting regarding the treatment, and I might come back to that later, because I think there's a lot of questions and it's so individual as well. So we might come back to that whole treatment element of it maybe in a little while, in a few minutes. But just before that, because you've mentioned some symptoms there and some triggers, what happens if you continue to, we're not all the best advocates for ourselves. So it was lovely to have that little mindfulness from Harsh there at the start, but we don't always look after ourselves that well, and we can kind of brush off symptoms, or, if they're not getting worse or they're not really impacting, our daily lives. When should we actually go and do something about it? Like, when do we need to actually go, no, I need to actually get this sorted? Or, when do we take that and go a little bit further with it?
Well, I think if it's something that starts to bother you on a daily basis, then it's something that needs to be looked into. If it's starting to affect your performance at work or how you enjoy your lifestyle, I think that often dry eye can be very insidious on how it sets up. So maybe you used to wear your contact lenses all day, every day, and now you think to yourself, oh, I don't want to put them in. It's just Tuesday. I'll just wear my glasses to work today. And then suddenly you find yourself maybe a year down the road only wearing your contact lenses when you go to the gym. And you think, oh, well, I used to wear these every single day, but it kind of crept up on you that you were wearing them less and less and less. Same thing with eye makeup. Maybe you think, oh, I don't need to wear it today. I'm not going into the office. I'm just at home. And then the next time you go to wear it, it kind of irritates your eyes and stinging and burning. So the awareness is super critical, because this can just be a slow slope that the dryness gets worse and worse over time. Okay.
So really, it's when you step back and maybe think that contact lenses, I love that example. I suppose personally I can identify with it. Maybe that's why I can, but you don't even realize you're rationalizing your use of something until, you speak to somebody like you. Is there any little test that you can do, let's say yourself, to check, what's the cutoff point, or, is there any little things you advise your patients to do in order to ascertain, whether they need more advice or to come to your clinic?
So something that's super fun to do is just try to hold your eyes open. So if we were to try not to blink and just have a staring contest and just hold our eyes open to the count of 10. And if you feel like your eyes are stinging and burning, or you just have to close them before you get to 10 seconds, that's not normal. You should be able to hold them open for 10 seconds and still feel comfortable. So that's just a quick and easy test. I also think that on the Scope website, there's a couple questions that you could fill out real quickly and find out whether or not you have some dryness.
Okay, great. So I hope everyone was taking those 10 seconds. To be honest, I was nearly afraid to do it myself. But take 10 seconds. So you're saying, look at something, hold your eye open, do not blink for 10 seconds and see how uncomfortable it gets. And if you can't last the 10 seconds, you need to look into that further, correct?
Correct, yes.
Okay, perfect. I think that's really practical, that I think most people hopefully are doing right now or can do. So let's say I've done it, I last, let's say 5 seconds. And as I said, the contact lens, I'm feeling that, maybe my eyes are red, maybe people are wondering, what am I actually, doing, that I have such red eyes all the time? And I decide, right, I'm going to come to your clinic. So I walk into your clinic. It's very far away from me, actually. So it's quite a long distance to get to your clinic. But let's say I walk into a clinic. That can be quite scary. Like, so, you know, talk me through, I land at your door. What happens next?
Well, I think it's quite comfortable. It's not a scary experience at all. Many eye doctors start with a survey. So they actually maybe just hand you a piece of paper for you to log your own symptoms. What are your symptoms? How severe are they? And how often do you feel them? That's one of my favorite surveys to use. It's just 8 short questions. And then we get a score. From that score, we can repeat that survey time and time again to see if you're getting better or getting worse. So that's probably the first thing we start with. And then we'll examine your eyes. We'll look at the actual tear film. So we may instill some dye, a yellow or green color, to the tears, because obviously our tears should be clear. And putting a dye in the tears will help me to see where they are. That might indicate that there's inflammation. That might also indicate that the front surface of your eye has dried out. And so the tears pool in the areas where there's a dried spot. We'll also look at your lid margins, checking for something like blepharitis, which is an overgrowth of bacteria that are normally on our lids and lashes that get overgrown when the conditions are just right. We may push on your lid margins to try and get oil to come out of them, and that allows us to know how long your tears are going to last in your eye. We may also use some specialized testing to take an X-ray of those oil glands here in the clinic. And it's really not uncomfortable at all, any of these tests. They're fairly quick. We might hang some little strips of paper from the side of your eye to measure how much liquid is in your eyes. We might test the quality of that liquid to say, is it super salty? Is there inflammation in it? And so there's just a bunch of things, depending on which clinic you go to, that they might test to see the 3 different layers of the tears, which one has kind of stopped working well.
Okay. And, you know, you said you checked the 3 different layers of the tear, so the 3 layers to the tear film. Does that inform then the advice that you give, or let's say once you do those assessments, and can you give me some examples then of, let's say, if my, you know, different parts of the tear film was affected, what kind of advice
Sure.
would you give? Yeah.
So, so there's 3 layers to the tears. There's the watery layer. Well, let me start backwards. There's a mucus layer that comes from the front of the eye, and it holds the watery layer on. The watery layer comes from your lacrimal gland, which is in your upper lid, and that produces the water when we cry. It also needs to have just a baseline amount of water that's produced all day long. And then the 3rd layer actually comes from our upper and lower lids, from the oil glands in there called meibomian glands. And every time we blink, our eyes should come together. A little bit of oil should come out and spread across the watery layer to keep the water in your eye instead of allowing it to evaporate out into the air or just run down the side of your face. So different symptoms may indicate a problem with the different layers of the tears. And then once your eye doctor examines your eyes and all the layers of the tears, they can determine what is falling apart and what we need to do to put it back together again. Whether it's just an oily layer problem, because you stare at the computer for long hours and you're not blinking on a regular basis, and those oils get clogged. And then we can treat the oily layer by doing a treatment on the lids. Or perhaps you have a systemic disease like an autoimmune disease, maybe Sjogren's syndrome or rheumatoid arthritis, and you just don't produce enough water. So depending on where your dry eye is coming from, then we categorize the treatments or prescribe treatments specifically to the type of deficit that you're having.
Okay, and I think just from looking at the questions in the chat coming in, there's a lot of people with Sjogren's actually on the call. So, I mean, is there anything specific for those patients? I will look at the individual questions in a minute, but just to keep it general, you know, you mentioned about the water, the aqueous layer, etc. there.
Right. So those
yeah.
patients have a particular problem in producing the watery layer. And so anything that we can do to make more water, so drinking lots of water can be helpful. There are medications that help patients produce more of their own tears. And I don't want to name medications because it's different between the US and the UK. So, but your eye care professional could prescribe a particular medication to either bring down the inflammation in your eyes because you don't have a lot of tears and the inflammation is high, or something to help you produce more tears. Punctal plugs are often used in a Sjogren's patient to keep whatever tears that they do have to kind of trap them in the eye. Hydrating with artificial tears, also a great adjunct therapy for these Sjogren's patients.
Okay, and just on that one, the question came in there about just maybe is this more the oil or the lipids?
No, in the Sjogren's patients specifically, it's the watery layer that they're not capable of producing on their own.
Okay.
Although it can lead, if you've had Sjogren's for a while, it leads to a deficit in the oily layer and the mucus layer.
Okay. Okay. And, let's say, so, I've gone to your clinic, and is there anything then I can, I walked in the door and it's not scary, it's a comfortable place. I get my assessments done. I mean, is there anything that you need from me? Is there anything I can do to prepare before I go to your clinic?
Absolutely. So as we were talking about in the beginning, dry eye is multifactorial. So there's a lot of things about you, your person, your being that I need to know in order to see where your dry eye is coming from. So from your presence, I can know that you're female, I can guess your age, but your medical history is super important. So as we were just saying, there are certain diseases that are highly linked to dry eye, such as autoimmune diseases, thyroid, diabetes, and even allergy. So looking at your past medical history, your family history, because maybe you don't know that you have an autoimmune disease yet, but you know that your older sister or your mother did. That's important. And then your medications. A lot of us take medications, whether they're prescribed or just over the counter, that decrease the amount of water that our body produces, such as antihistamines. So here we are in the spring, and maybe some of us have swallowed an antihistamine tablet this morning to keep us from sneezing or our nose running, and that's drying our eyes out.
Okay. There's a lot there, isn't there? And, is things like, do you go through, you mentioned the questionnaire, things like triggers. Is that useful for people to document, let's say, what triggers or when triggers, etc.? Is that helpful?
Absolutely. So knowing when your eyes feel the driest, whether it's first thing in the morning or at the end of the day, or after you've been on the computer for not 30 minutes, but 2 hours, and that's what's drying your eyes, then there are tools that your eye doctor could recommend that you try to overcome those triggers. In fact, I just want to mention that I did prepare a handout for everyone today because this was working with dry eye. So I prepared a little downloadable guide that would help you set up your computer system. And it's available at my website, which is pamtheriot.com/work. WORK. And my last name is THERIOT, pamtheriot.com/work. Anyway, it's got about 7 steps for you to set up your workstation. If you want to check that out at some point, I'm happy to share that with you guys.
Great, thank you. Well, we'll get Amy or one of the ladies to put it into maybe the chat function. Everybody can copy it there. And that's as well you mentioned there about kind of your environment, your workstation, like you can actually do things regarding the position of your computer, etc. to help.
Yes,
that correct?
To help.
Wow,
yes.
That's very interesting. I think it kind of reflects ergonomics. That's in a lot of different things anyway, but we don't normally think about for the eye. It's normally your posture and your back, but actually that's great to know about the eye. And then you mentioned there about, let's say, blinking. Like, I suppose blinking is blinking. No, is there something specific about blinking?
I guess we've never thought about blinking. It's just something that happens, right? But what I was talking about earlier is that when we're on our digital devices, we tend to blink less. In fact, studies have shown it goes down by like 1/5. So maybe we normally blink 20 times a minute. Like I said, if we were in a cafe and I was talking to you, but here on the screen, I may only blink 5 times in a minute. And so because our blinking is so decreased, while we're on these digital devices. We need to, in turn, think about it and do some blinking. I like to have my patients do the 20-20-20 rule. Us optometrists, we think we're so cute. We talk about our vision being 20/20, and so we turned it into a 20-20-20 rule. So let me just explain that super quick. So every 20 minutes, you should take 20 seconds to look 20 feet away. That's like refocusing your vision. And I like to add a little tidbit in there. Once you've looked far away for 20 seconds, then give yourself a couple of really firm blinks where you squeeze your lids, trying to make those meibomian glands release some oil. And you can do 3 real hard blinks, maybe over 20 seconds or a few seconds at a time, just really blinking the eyes, trying to get the oils to come out of the lids, and doing that break every 20 minutes.
Okay. That's actually quite frequent, isn't it? If you're, it seems quite frequent, so probably need to remind yourself of that one. And, one question that came in was, that blinking to help with the release of the oils. I mean, how else can you help release the glands or the oil in the glands? Do you have any little techniques that you use, or how would you do that?
Sure. Well, if you came into my clinic and we knew that you had a problem with the oils being stopped up, there are some in-office procedures that we might consider. But at home, it's easy to use a warm compress that perhaps you put in the microwave, or they make some that you plug in, that you'd lay over your eyes. That helps to raise the temperature of the oils that are inside of our lids. We all have these oils in there. They're normal to be there. And some of us, the oils get trapped, and by heating them up, it melts the oil. So from a stick of butter that you put in the refrigerator, it's nice and hard. You bring it out and you put it at room temperature, or you heat it up, it's going to start to liquefy. So that's what we're doing with a warm compress. We lay that over our lids for at least 10 to 12 minutes, and that'll allow the oils that are trapped in the lids to start to liquefy and come out onto the eyes. And so you could do that 1, 2, 4 times a day if you really wanted. That would help to express the oils.
Okay. And is there anything else that you do in terms of, like, once do you rub, or do you do anything like that to help with that? Or
yeah, you could gently do some eye massage where you take your fingers and roll from the bottom of the lid to the lashes, and then at the top, from the top of the lid down towards the lashes. So everything would roll towards the lashes. That's where the orifices of these glands are. So the oils are going to come out near the lashes, and just kind of gentle pressure. We're not grinding. We're just gently pressing on the lids. Okay. Of course, clean hands.
Yes. I think we're all good at that now. I hope we're all good at that now. Yeah. And then, you mentioned the blink and the oils there, and someone's saying that, at nighttime, maybe their eye doesn't close fully, and just when you bring up about, let's say, the importance of blinking and just the transfer of oil across the surface of the eye. I mean, at nighttime, if someone's having issues, and maybe even an eye staying open at night, is there anything, is that common, or, how do you advise to address that?
Right. So it's not common, but it does happen that people don't get their eyelid fully closed, or maybe they've had some kind of lid surgery and there's a space where the eye is exposed while they're sleeping. And in that case, it's really important to cover the eye, whether you want to use an eye gel or an ointment that you'd put inside the eye when you go to sleep. Some doctors recommend that you patch or tape the lid down and try and get it as closed as possible. There are also like a sleep mask that maybe the kind that you get on the airplane when you travel internationally, or even some sleep goggles that give a seal around the lids and would create like a moisture chamber. So there's different levels depending on how open your eye is staying or how dry they are in the morning, but keeping your eyes hydrated while you're sleeping is one of the most important things, so that when you wake up in the morning, you're already refreshed.
Okay, and actually you mentioned a question came in about the moisture goggles. So it's not something that I'd be that familiar with. So you mentioned there about nighttime use, and I think I'm not sure who sent the question in, but it was more that, air conditioning and real exchange wind and things like that really affect the drying of the eyes. And she or he was just wondering, our eye goggles or chamber moisture goggles suitable for that? Or when do you normally recommend for them to be used?
So I think we're talking about two different things. So
Okay.
the question about daytime use, they're talking about moisture chamber glasses.
Okay.
And these are more like a pair of eyeglasses that have side shields. And often in the side shield, there's a little piece that you could pop out where there's a sponge, and you can moisten the sponge and then pop it back into the side shields. And it gives a covering from the top and the bottom and the sides, but it's more like a sporty looking glass that you could wear either clear while you're indoors, or a tinted one for sun protection when you're outside. So that's something that you could wear if you are bothered by the environment indoors or outdoors. The other one that I was talking about is more of like almost like a swim goggle that goes over the eyes, and it creates a real moist seal around the lids. But the sleep goggles aren't meant to view out of them. So once you put them on, they may be a dark color, and you don't leave them on for periods of time and wander around the house with them on. Yeah, two different kinds of things.
Okay. So thank you. That's very interesting to make the distinction between the two. So we talk about nighttime. So I'm going to go really practical now. So, I wake up in the morning. I've got dry eye.
Thank goodness.
Yes, that's true. Thankful for that. So, what does a normal day or a regimen look like in terms of, let's say, living with dry eye, not just working with it, but living with it?
Right. So I recommend to my patients 4 simple steps that they use every day, twice a day, usually is what I recommend, to get their eyes healthy and happy. So the first thing I would say is you wake up in the morning, perhaps your eyes already feel dry. I know morning is one of my worst times personally. So I've used an ointment at night. And so then hopefully I've gotten my eyes open when I wake up. I go into the bathroom and I will use a scrub or a cleanser for my lids and lashes. So there's 2 types of cleansers that I might recommend, either a cleansing gel to like almost like a shampoo to cleanse the lashes, or in milder dry eye or patients with sensitive skin, we might recommend a hypochlorous acid spray, which will cut down on the bacteria that are living on our lids and lashes. After that, you might want to hydrate your eyes using an artificial tear. One of my favorite is a product that you guys make called Dry Eye Intense Drops. It's really, the moisture stays on your eye because of the hyaluronic acid in the formulation. So that feels super comfortable. After that, go ahead and do one of those warm compresses. So your lids and lashes are clean. You heat up your mask and lay it over your eyes for 10 minutes. And then finally, when you go in, have your coffee and your breakfast, I would take a nutritional supplement that has a high count of omega-3 fatty acids, and that will help your body to reproduce the oils that they need to make those healthy tears.
Okay, perfect. And just when you talk about the supplements there and the role of supplements, I mean, have you come across vitamin D as well? Just one of the questions that came in for dry eye, and just to get your opinion on that would be great.
Yeah, so vitamin D is deficiency has been shown to give a higher increase in dry eye symptoms. There haven't been a ton of studies done on exactly how much vitamin D you should supplement with to raise the level of vitamin D in your body to make a healthier tear. But some of the dry eye supplements that contain omega-3 fatty acids also include vitamin D. So that might be something you want to look for. There's one here in the US that I like a lot that includes both the omega-3s and the vitamin D. So I don't know if you guys have that in Ireland though. So, yeah, you could look for a combination. And just if there's blood tests for vitamin D as well, so your doctor could check to see if you're low on vitamin D and just go with their recommendation of your level of deficiency and what they recommend to raise the vitamin D level.
Well, I definitely know for one thing, we don't get enough vitamin D from sunshine.
Right.
So that's, especially, the few months of the year that just the latitude that we're at just cannot synthesize the vitamin D in our skin.
Right.
Thank you for that. So I have my 4 steps just, I'm wearing makeup today, and a few questions come in about makeup. So, the morning routine versus the night routine and maybe makeup removal, it's quite a big question. What do you have things you look for in a makeup remover, or, what would what's the practical recommendation here?
Well, I think the most important thing is that we remove our makeup every single night. Never go to sleep with your makeup on. And of course, I have a few favorites, but looking for something that is free of toxins. And there's even some microfiber cloths out there that just use water and the cloth. And that's probably the easiest way to know that you're not adding any toxins to your eyes, and being able to remove all of the makeup. After you've removed your makeup, then I do one of those lid scrubs I was just talking about, whether it's a pad that's pre-soaked in the scrub, a foaming cleanser, or the hypochlorous acid sprays. Any of those you could follow after you remove the eye makeup, and that would be super important. I think one other thing I want to say about makeup is no waterproof makeup. I know a lot of dry eye patients or contact lens wearers, they gravitate towards using waterproof makeup because they think it's not going to run down their faces. But waterproof, the things the components in a waterproof formula that make it stick to your eyes are also going to be more toxic to your eyes and harder to remove in the long run. So I think waterproof.
Wow, that's a really good tip, actually, because they're to really look for the non-waterproof mascara,
Yes.
and to clean it off properly. Actually, it should be easier to clean off, hopefully, if it's okay.
It should be, yes.
Yeah. So look, we have a few specific questions coming in now, if that's okay, Dr. T. So we'll go through those. And again, everyone, the interaction is great. So keep the questions coming in. We're doing our best. So I'm just going to shoot. Look, this is the rapid fire round where you get lots of questions. Just somebody suffering from Sjogren's and chronic blepharitis, is there any specific thing that you do differently? I know you mentioned both of these conditions earlier on, but anything specific on that one?
Well, if you have blepharitis, your eye doctor may actually prescribe either an oral antibiotic or an antibiotic that you put on your lids and lashes. But above and beyond, something that you could do over the counter or simple part of your daily routine would be to follow those 4 simple steps, because there we've got the cleanser in there, either the foaming cleanser or the hypochlorous acid spray would take care of your normal bacterial blepharitis. So either way, you'll be getting rid of the excess bacteria on the eyes.
Okay, so really deal with the blepharitis. Treat that, get rid of it.
Yeah.
And then, okay.
The environment of our eyes when they are dry is more conducive to having bacteria grow on them. So it's very common for dryness and blepharitis to live in the same environment there, and just keeping the lids clean with one of these scrubs or sprays, super important and easy to do.
Okay, perfect. Another one now on continue on the blepharitis theme now, rosacea and blepharitis, and they had their doctor prescribe an immunosuppressant, and the GP was a little bit surprised by that. Is it normal to use immunosuppressants in rosacea, I suppose?
And so I believe that question came in, it was regarding cyclosporin, which is a very common drop to use for dry eye syndrome. And so in the eye, because there's so much inflammation, the cyclosporin drops help to bring down the levels of inflammation, and it doesn't actually reduce your immune system systemically. It's just going to reduce the inflammation on the eyes, and that's an absolutely normal prescription medication to use in treating dry eye disease. So
okay, and the thing I think you said there, topical versus
systemic.
So it's really localized treatment, and it's normal, so no need to be afraid of that. Okay. And I think we covered another one there regarding the eyes at night, so you've covered that one. Just regarding, there was one question regarding, we said about triggers earlier on, but then I suppose, and I think you mentioned age at that stage, but menopause, regarding, do we expect changes with menopause, or how does that affect the eyes?
Absolutely. Menopause is a big trigger for dry eye disease in general. When that shift happens in our hormones in our body, we produce less moisture overall, and that shows up very significantly in our eyes. So things that would replace the watery layer, like artificial tears, punctal plugs, or prescription medications that help you produce more of your own healthy tears, are important.
Okay. Yeah, and then I suppose just you mentioned the punctal plugs before, but and you mentioned it with Sjogren's, but would you just go back there about just explaining the punctal plugs again, and just on how effective they are in terms of managing dryness?
Yeah, so I think at this point it's important to point out two things about dry eye disease. Number one, that it's multifactorial. It's not just coming from one problem that we're having. It's all the things, especially as women age with our hormones, makeup wear, contact lens wear, staring at our screens, live in a place that's either too dry or too allergy, too much pollen going on. So it's multifactorial, but the thing that all of these factors kind of bring to the eye is extra inflammation. So once your doctor has reduced the inflammation in your eye, whether it's through an immunosuppressant eye drop or a steroid eye drop or just hydrating with more tears, then it's safe to keep the tears that you do produce on your eye. And a punctal plug is something that you put in the puncta of the lid. So in our lids, the lower and the upper each have a teeny little hole that the tears should drain out of and then down into your nose. So this is why our nose runs when we cry, when we produce a lot of water. The water goes through that canal and into our nose, and then our nose runs. Normally, all day long, we're producing tears, and in that those tears are just going into the puncta and going into our nose and just lubricating our nasal passages, and it's absolutely normal. In patients that don't produce enough tears, it's often a common practice to use a little silicone stopper that's kind of a permanent plug that you put in and you could remove at some point. There's also collagen plugs that you put in and they just dissolve over time. And there is a drain in the lower lid and the upper lid. And so doctors often just plug one so that you still have the lubrication going into the nasal passageways. But in some patients who have severely dry eyes, they may plug both the upper and the lower puncta to really keep all the moisture on the eyes.
Okay. So, it would be a common treatment or, yeah. Okay.
It is quite common.
Perfect. And then just probably a newer treatment someone's asking about is about the new infrared heated eye masks. Any specifics, have you much experience with them and what's your thoughts?
So I love using an infrared mask because it actually helps to penetrate the heat into the tissue of the eyelid and reach the meibomian glands much better. So it's also good for patients who have rosacea on their skin. So rosacea causes little red blood vessels on the cheeks and nose and even in the eyelids. And so heat is a trigger for rosacea. So often when we do a warm compress, the rosacea looks worse immediately after. And so utilizing one of these infrared masks will give you the heat that your meibomian glands, your oil glands need without heating up the skin around the eyes and making the rosacea appear worse.
Okay, so managing that heat, but in patients with rosacea, and actually just on
more
the topic,
targeted,
more target, more specific, and just on rosacea, because I know rosacea can be caused by Demodex mites, but someone here is asking about Demodex in terms of blepharitis, and just can you please mention what conditions may have led to the Demodex? So what is there anything they can do, or what advice would you give there?
So we all have Demodex on our skin. So let's just stop right there. Nobody freak out that you have bugs in your eyes and that you're the only one. Unfortunately, it's a normal part of our life's process that we have Demodex. And, maybe we pick it up from a pillow, or it's just something that lives on the human body. And so there are conditions that may facilitate the Demodex becoming more overgrown. Again, the dry eye is just a more comfortable environment for those Demodex mites to flourish. And the older we are, the more likely we are to have Demodex. But by the time we're 80, it's like 100% of us have Demodex on our lids and lashes. So it's absolutely normal. Now there's tons of treatments for Demodex. One that's common to use at home is a tea tree oil cleansing scrub. The tea tree oil actually kills those Demodex mites. One of the ingredients inside tea tree oil, terpene 4-all, can kill the mites. Also, if you do an IPL or an intense pulse light treatment, that will kill the Demodex as well. So there are treatments that you can do in the doctor's office or at home to reduce the Demodex burden on your lashes.
Okay, so normal to have it, we just need to control the growth. Okay, and watch out. And you mentioned your IPL there, because that's quite, I suppose, I think it's more progressive in the US and it's quite new here in the UK and Ireland. Can you just, what is IPL for people that may not have come across it?
Sure. So IPL is intense pulse light. It's used to treat rosacea, or the tiny blood vessels that are irregular on our skin. So the doctor uses a device that gives intense light in pulses and just goes along the cheeks and the nose here, and it cauterizes these irregular blood vessels. And the thought is that the blood vessels are bringing inflammation to the eyes. So because they are irregular, and both rosacea and dry eye disease are inflammatory in nature, that those blood vessels are bringing inflammation to the front surface of the eye. And by cauterizing them or closing off those blood vessels, not only will you look better because you have less redness on your cheeks, but there will be less inflammation getting to your eyes, and the dry eye disease will improve.
Okay. It sounds very interesting, and I just see someone commenting there that says it's brought them a lot of relief, so that's good. I mean, just in terms of another, we have a few people with glaucoma and dry eye on the call, and you know, just regarding there's a few questions here. The first one here I can see would be in terms of, let's say, the heated iPads and the masks. Are they safe to use in patients with glaucoma?
So it really depends on your type of glaucoma and what you've had surgically done to your eye to treat glaucoma. So that's something that I would specifically bring up with your glaucoma specialist. If you have a bleb or a stent that releases some of the fluid from your eye, the warm compresses might not be safe, and I would absolutely speak with your specialist about that. But glaucoma and dry eye unfortunately go hand in hand because of the fact that you're using an eye drop to treat your eye pressure. And many of the glaucoma drops have preservatives in them. And these patients are using multiple eye drops multiple times a day, and it's just a lot of preservatives for the front surface of their eye to tolerate. And over the long run, you can get significant amount of dryness from that.
Okay, I suppose you mentioned like toxic chemicals before regarding makeup and things like that, you know, and the mascara, and how it's important to choose the, you know, the non-waterproof. But just on preservatives there, you know, is that something that you watch out for yourself regarding preservatives in, you know, formulas that go into the eye?
Yes, so in general, preservatives in eye drops can be very toxic to the front surface of the eye. So anytime that you have the option to choose a non-preserved version of even if it's an over-the-counter drop, like an artificial tear, the ones that come in vials that you throw the vial away after you've opened it, or the multi-dose preservative-free bottles are important. And many of the drops that we use to treat glaucoma these days also come in a preservative-free version. And so you can reduce the burden of these preservatives on the front surface of your eye.
Okay. Okay, and just to maybe to come out of the eye now, someone's asking about, you know, the cleansing of the eye with earbuds, you know, with little buds.
Oh, okay, like Q-tips is what we call them here in the US. Little sticks.
There we go.
So a lot of doctors recommend you scrub with a Q-tip. It really depends on your dexterity. I prefer my patients to use their fingertip because it's less likely that they're going to jab their finger in the eye than using one of those little buds that could inadvertently give you an abrasion. So it depends on how careful you are. I know as women, we're used to, you know, doing our mascara, and we're very cautious. But if you have any dexterity problems, that you have any tremors, you don't want to be using something small and pointy near your eye.
Okay, perfect. And again, just on the cleansing, do you know, you mentioned your online book that we have put the link to, or the information. Does that cover cleansing? You know, you mentioned the steps of cleansing, it's all covered in there. So I'm going to park, just to let you guys know, I've seen the questions, but I'm going to park them because they're all addressed in the information booklet, if that's okay. I'm watching our time here, so I'll try and get a few other ones in to keep you on the spot. Just somebody with hypothyroidism, you know, and they're just wondering how much would that affect their dry eye, and they have had occasional blepharitis and high pressure in the past, but that's now under control. So, you know, is there a connection there? And then, you know, how to manage that?
Yeah, so I think that's one of the things I commented. Thyroid disease is actually the most common trigger for dry eye disease, or it's the most common systemic disease related to dry eye disease, and it causes your body to decrease the amount of water that's produced. So over time, reducing that amount of water will then affect the mucus layer and the oily layer. So important, if you have thyroid disease, to see your eye care practitioner and let them get you on a multifactorial treatment plan, because now we know that there's a systemic cause for the dryness, and you may need more than one treatment. But again, all of my patients are on those 4 simple steps really to help keep their eyes healthy and happy.
Okay, perfect. There, just to say as well, there's a lot of specific questions regarding individual medications, but do you know, is it okay maybe we send them to you and we can get back individually regarding the individual medications? So we will come back to you, but I'm not going to go through all of them. I just want to go back to maybe the more dietary element now, because you mentioned before vitamin D, we've talked about the omega-3, and you say you recommend the omega-3. What about, you know, for zeaxanthin, or, you know, the more carotenoid based, you know, minerals or vitamins, I should say? Do you ever use them? Or, you know, and maybe not on dry eye, but we may use them for AMD, or, you know, where do you position your vitamins? Yeah.
So eye vitamins are important. For any patient, I recommend taking a multivitamin, because we just don't get enough nutrients from our diets in general. Lutein and zeaxanthin are important in macular degeneration. And so there's a lot of studies to support increasing those levels of lutein and zeaxanthin when you have macular degeneration. And there's evidence to support reducing your omega-6s, increasing your omega-3s in patients who have dry eye disease. So,
okay. So I suppose just know what you're using them for, and then and then the generic multivitamin then is there just to compensate overall. Okay.
Right.
And then I think I'm going to finish on this one, I think, but just we talked about the chamber, the moisture chamber, but somebody's asking about anti-glare sunglasses. You know, what exactly are they? What do they do? And I suppose, where do you get them?
Oh, okay. So I wonder if specifically you're talking about polarized sunglasses, which cut glares. So a polarized sunglass is something that's added to a normal sunglass. It doesn't have anything to do with the UV blocking, but it actually cuts glare from, like, if you're looking at a body of water, like a lake or a river, and it would cut the reflections coming off of that. A lot of dry eye patients are also very sensitive to light. And so anything you can do to reduce the amount of light getting into your eyes would just cut back on irritation. So a darker sunglass, one that of course gives you UV protection, especially there in Ireland where you don't have a ton of sun, but you do have UV coming through the clouds. So using a UV protector, maybe a lighter tint, and then that polarized function will cut back on glare coming off of water.
Okay, perfect. Great. I'm going to stop our rapid fire round there, because you've answered a huge amount, and I know Mandy's in the background addressing some of the questions as well, and there'll be a few additional ones that we can answer maybe after the call. But I would like to thank you so much. That was so informative and practical, but also accessible. And I see the comments coming in saying excellent. So we really thank you for your time, more importantly, your expertise, and also for preparing that booklet to actually support this talk, so everybody can actually have something to take away. And I think once you hear it and then you read it again, it's much easier to remember. So thank you for that. So on that note, I'm going to hand over as well. So thank you. And we'll hand back to Tom. Thanks, Tom.
Great. Thank you.
Thank you very much, Edel, and thank you again, Dr. Theriot. That was absolutely brilliant. I can tell you, in the rooms in Scope here, we were working like crazy to try and answer all those questions. So it was great to see the engagement and some massively practical advice for people. So hopefully you enjoyed it. There is going to be an exit survey as you leave the Zoom link that's really quick and short, so we'd love your honest feedback. Tell us what you thought, because it'll help us as we build the next programs. And that's something to mention as well. Our team is going to be throwing it into the chat there now, is the next event we hope to hold later in the year in July, which will be a more in-depth session. And we'd love to see you at that one as well. So if you've enjoyed today, tell your friends, tell your family, because there's going to be lots more education coming from Scope on dry eye and how to manage it. I'd like to say a special thank you to these people in Scope, just who've been working really hard to put this event together in the background. Nothing happens without amazing people. We have an incredible team here at Scope, and a massive thank you for producing another high quality event. So that's it. I hope you enjoyed it. Give us your feedback, be honest, and have a great day. Enjoy the sunshine. We will here in London. All right, goodbye everyone.